Hello everyone, it's a pleasure to be here and share our research with you at this international conference. My name is Yejin Kim and I'm a postdoctoral researcher at Sungkyunkwan University. Today I'll be presenting our study titled Validation of the UCLA Loneliness Scale during the COVID-19 pandemic in Korea. In this presentation, I'll first introduce the background and rationale of the study, and then describe the method and key findings, and finally discuss the implications of our results. Before we move into the study detail, let me start by providing some background on the concept of loneliness and why it matters. Loneliness is as old as humanity itself, yet only in recent decades has it become a subject of systematic scientific inquiry. It is a complex emotional experience that occurs when our need for social connection and intimacy is unmet, leading to feelings of isolation and distress. As social beings by nature, humans are deeply vulnerable to loneliness, which is now recognized as a serious clinical and public health concern linked to mental illness and even mortality. Many studies show that chronic loneliness can be as harmful to health as smoking 15 cigarettes a day, highlighting its global health impact. During the COVID-19 pandemic, society faced what could be described as a double crisis: the spread of the virus itself and the surge in loneliness and social isolation. While public health measures such as lockdown, social distancing, and mobility restrictions were essential to prevent infection, they unintentionally deepen feelings of isolation and social stigma. Even after the official end of the pandemic, the psychosocial consequences of loneliness and disconnection continue to affect people worldwide. Therefore, it remains crucial to assess loneliness using valid and reliable instruments that can capture its ongoing impact in the post-pandemic era. Russell and colleagues criticized earlier measures of loneliness for having too many items, low reliability, and limited external validity. They emphasized the need for a simpler but psychometrically robust instrument. The revised UCLA loneliness scale improved upon earlier version but contained negatively worded double negative item. For example, I am not unhappy being alone. Such wording often confused respondents, especially older people. To overcome this issue, the UCLA 3 was developed. Since its introduction, it has shown strong validity and reliability across multiple languages, including French, Turkish, Dutch, Spanish, and Chinese. However, no prior research had evaluated the psychometric properties of the UCLA during the COVID-19 pandemic. Building on this background, our study sought to validate the UCLA 3 in the Korean context during the pandemic. Therefore, the present study aimed to examine the factor structure, internal consistency, and constructability of the UCLA among Korean adults during the pandemic, using both traditional and modern psychometric approaches, including item response theory based on the Rush model. Additionally, this study utilized longitudinal panel data to assess the stability of the scale over time. Data for this study were collected through a national aligned panel survey agency in Korea at 3 time points. The surveys were conducted from February 2021 to July 2022 at approximately 8 months intervals. At the first wave, 2,440 adults were invited to participate, and after excluding low quality responses, 1,434 cases were included in the analysis. By the third wave, a total of 597 participants had completed R3 surveys. Later's MCAR tests showed that the missing data were random, indicating that there was no systematic bias. Finally, the sample was stratified by gender and age based on the Korean national census, ensuring the representativeness of the data. Now that we've covered the sample and data collection, let me briefly explain the measures and analytical procedure used in this study. Loneliness was measured using the UCLA Loneliness Scale version 3, which consists of 20 items rated on a 4-point Likert scale, ranging from 0 never to 3 almost always. In addition to loneliness, we also examine several related variables, social demographic factors such as gender, age, household type, and vulnerability to infection, as well as psychosocial correlate including social support, stress, and hopelessness. Finally, we assessed mental health outcomes, including depression, anxiety, suicidal ideation, and life satisfaction. After defining these measures, we applied several statistical analyses to evaluate the psychometric properties of the scale. To examine the factor structure, we first conducted an exploratory factor analysis using the T1 data. Next, we performed confirmatory factor analysis on the T2 and T3 data sets to cross-validate the model. Model fit was evaluated using common fit indices, CFI and TLI values of 0.90 or higher were considered acceptable, while RMSEA and SRMR values of 0.08 or lower indicated good fit. In addition, a Rush model analysis was conducted on the T3 data to assess item level fit and category functioning within the item response theory framework. Now let's move on to the main result. The factor analysis revealed a clear three-factor structure of the UCLA loneliness scale, consisting of isolation, connectedness, and social support. Both the EFA and CFA showed good model fit and strong factor loading, supporting the validity of this structure. The Rush model analysis further confirmed that the 4-point scale functioned well, though one poorly fitting item was removed. As a result, the final COVID-19 loneliness scale included 19 items across the three sub-factors capturing feelings of isolation, social connectedness, and perceived support. Overall, the result demonstrated that the scale was psychometrically sound and stable over time. Let's take a closer look at the reliability and validity of this final version. The scale showed excellent internal consistency with reliability coefficient above 0.90 across all time points, and test-retest reliability was also within the acceptable range. In terms of conversion validity, loneliness was negatively correlated with social support and life satisfaction, and positively correlate with depression, anxiety, stress, hopelessness, and suicidal ideation. This result confirmed that the scale is both reliable and valid for assessing loneliness among Korean adults. Moving on to the discussion, I briefly summarize the key interpretations and implications of our findings. This study validated the three-factor structure of the UCLA 3 among Korean adults during the pandemic. The findings were consistent with previous research, which identified similar dimensions of isolation, relational connectedness, and collective connectedness. By applying the Rush model, our study provides a more detailed understanding of the scale psychometric performance. The 4-point Likert scale worked well, helping make responses clearer and less confusing. The removal of item 17 highlights the importance of carefully examining response style and category functioning when evaluating constructability. While the final 19-item scale effectively measured moderate to high levels of loneliness, its precision was somewhat lower for respondents with low levels of loneliness, suggesting an area for future refinement. Beyond three measurement findings, our study also offers meaningful contributions for research and policy. This study is the first in Korea to examine the psychometric properties of loneliness during the COVID-19 pandemic using both classical test theory and Rush modeling. It provides baseline data for tracking changes in loneliness and social connectedness in the post-pandemic era and offers practical implications for prevention strategies and mental health policy. Based on this validity scale, a follow-up longitudinal analysis identifies three distinct trajectories of loneliness: a low-level increasing group, a high-level decreasing group, and a moderate-level decreasing group. Among the key predictors, age, social support, and hopelessness were significant. These findings suggest that enhancing social support and reducing hopelessness are crucial strategies for alleviating loneliness in the community. Also, this study has several limitations. First, the sample included only Korean adults aged 20 to 59, which limits the generalizability of the findings to other age groups or clinical populations. Second, since our participants were from a single cultural context, the cross-cultural applicability of the result remained uncertain. Third, criterion validity with other loneliness scales was not examined. In conclusion, the UCLA Loneliness Scale version 3 showed strong reliability and validity in assessing loneliness related to COVID-19 context among Korean adults. The identification of distinct loneliness trajectories highlights the importance of targeted, group-specific interventions and evidence-based policy measures to promote mental well-being in both pandemic and post-pandemic societies. Okay, thank you for your attention. If you have any questions, please feel free to contact me via email. Thank you.